Hi everyone and welcome back to my channel. This video right here is out of New York. This is 1 year old and it's kind of it will give you an idea of what's going on in these nursing facilities. Pardon me. In these nursing facilities. Again, as I said in a previous video, this is nationwide. People are scared to lose their jobs, not have the money to provide for themselves and their families if they have families. So let's just get into it, guys.
Let their patients die. That's what Attorney General Letitia James said of 4 different nursing homes across the state of New York. Now let's break it down, because yesterday James filed a lawsuit accusing Centers Healthcare and its owners of stealing Medicaid, Medicare, and other funding meant for patient care. With the specific nursing homes in question all owned and operated by Centers Healthcare, and they're located in Queens, the Bronx, Westchester, and Buffalo. According to the suit, owners Kenneth Rosenberg and Daryl Hagler, along with others, constructed an elaborate network of companies and fake contracts to pocket $83 million in government funding over the last decade. And obviously, since that money was going in their pockets, it wasn't being used to help the residents. So as a result, the nursing homes were understaffed and the residents were facing neglect, degradation, and death. The lawsuit reportedly filled with testimonies from residents' families about their mistreatment at the hands of these nursing homes, including the story of a man whose bed sores turned into ulcers that ate away at him and he developed sepsis and died, and another horror story from a daughter whose mother failed to receive a colostomy bag to collect her waste, but instead was wrapped in a towel that quickly filled with feces. These nursing home owners stole $83 million and they let their patients die. That's what Attorney General Letitia.
Yeah, guys. So again, this is a nationwide issue. The facility that I'm currently at right now, working for, I should say, I'm not there right now, but the facility that I am currently employed with has 17 to 20. The owners have 17 to 20 facilities in Central Florida. Alone. They have some in other states as well. I don't remember what other states they're in. But this is a problem because, as we saw in my previous video, it's 30 patients to one nurse. Keep in mind that these people, these owners, have 17 to 20 facilities in Central Florida alone, right? So why are we not staffed? Why does the facility that I am currently employed with, why do the CNAs not have the supplies they need to wash the residents, right? There isn't any, or barely, sheets, towels, washcloth, like the linens, what they need to do their jobs. With so many facilities, you're making money off of so many people. Why are we underpaid? Why are we understaffed? Why does the state of Florida allow 30 patients to one nurse? And as I said before, these are the finger sticks, the blood sugar checks, insulin coverages, it's the eye drops, it's the creams, the powders, my statin powders, things like that. They're general medications for 30 people. The blood pressure checks to make sure that they're not under, the blood pressure is not low, and then you'll end up still giving them medication anyway. It has to be checked. Then I'm not sure if I spoke on this in the last video, but let's discuss real briefly 5 or 6 rights, whatever it is now. And if you're wondering how come I don't know these rights, because listen, I'm tired. I've been burned out from nursing for too many times now. And this is like really it for me for bedside. How are we going to do our rights? Right patient, right time, right route, right medication. I think I might have said that. Medication, patient, route, time, and something else. And I know they added pain to it, I think, as well. I may be incorrect on that, but you have to, basically the rights mean like you need to check. You need to compare with your MAR, your medical record, to the patient what they're getting. And carts are different. Some carts have like the like cards, so you have to like go through the cards and like, nurses, you know what I'm talking about. CNAs, like you've seen it too. You have to go through the course and like find a medication, and then a lot of time the medications are not even available. So it's time consuming. So let's think about time in the 1 hour before and the 1 hour after that you give a medication. Again, if a medication or treatment is due at 9 o'clock, you have as early as 8, as late as 10 to give that medication or to treat that patient. It's too much. These people have all these facilities. Food's disgusting. Patients always complain about food, and that's like in most facilities that I've been in, even in assisted living, by the way of which I reported abuse and neglect of the residents there like a few weeks after I had gotten there. And it continued until they fired me. But I also had video footage, and they tried to hit me with HIPAA. Listen, something needs to be done. Something needs to be done. There's no way that these owners are having all of these facilities and these patients are in the conditions that they're in. Nurses' licenses and freedom, and also CNAs, is on the line here. I think I heard like about a week or so ago, something like that, someone here in Florida, that a CNA had fallen asleep during like an overnight shift, I think in home care, I think. Because I heard it in passing like when I was like at work last week or so. And yeah, the CNA's in jail. Patient died on her watch. So guys, something has to be done. We need to stand together on this. Something like that should never take place. And when I was a CNA many years ago, again, I've been in nursing for like over 30 years. I've been a nurse since 2005. Before that, I was a CNA. So with that being said, this has been going on for a long time. I used to wonder, how does the state come in here and do a survey and they pass? Or they're fine, uh, uh, you know, how is that possible? Well, then, knowing that the state and also federal government is in charge of these policies and laws that's put into place for long-term care facilities and for healthcare facilities. Like, what is that? You people you know the acuity, what the patient's needs are. And you people are still thinking that medications and treatments are given properly or even being done. Let's be real. Let's be real. Let's be honest. Because at the end of the day, no matter what your belief system or karma, and I know some people say, well, I've seen people who go through life and they do things to people and they never get their karma. Sadly, that's true. But let me tell you, when you have a conscience, you move differently. Okay? And we got to stop seeing things and being complicit, knowing things and being complicit and not helping these people, these patients, these human beings. Okay? Again, this is just ridiculous. Having like all these facilities and not having the proper care, that's insane. So guys, start asking the questions when you're going to take your loved one or yourself to these facilities, and put your eyes or have someone else put their eyes and read to you, ask to see their latest survey. Go back a few years. You don't have to do it all in like one sitting. Just go back. Ask them about their first thing, ask them about their patient to staff ratio. And then go from there. Because so many of these people, and you have to think about it, they live there. So it's day in and day out, day in and day out. We can go to home, we can go home, we can do 16 hours, we can do 12 hours, but we go home. These people wake up to the same crap, go to sleep, and it's the same crap. So many complaints. why has nothing changed? So if you're a nurse or healthcare provider, please feel free to comment. Please share this video. You don't have to like the video, but please comment and share. Comment and share. And definitely please subscribe, because I will be having more videos on this topic as well as many others that I would love to have your reaction to. Again, thank you for watching, and I'll see you in the next one.